Hammersmith Hospital, London. The birth of a baby. A commonplace event. Yet this baby isn't commonplace. He was conceived not in his mother's womb, but in vitro, in a test tube. Every year, more couples try and fail to have a baby than succeed. 1 couple in 8 is frustrated by long-term infertility. About 1 million couples in all. Babies for adoption are scarce. For a few childless couples, a very few, a test tube baby proves the answer to their prayers.
Yes, go on.
£9.9. Lovely.
Towards the end of 1984, after years of anxiously consulting first one specialist, then another, 7 infertile couples were finally referred to the weekly clinic at Hammersmith Hospital in the desperate hope of having a test tube baby. From Hampshire, the Devereuxs and the Drummonds. From Sussex, the Cheramellas. From central London, the Gratwicks. From Middlesex, the Cassandros. From Hertfordshire, the Gadders. From the West Midlands, the Marshalls. For them, in vitro fertilization, IVF, seemed the last chance to assuage the grief of not being able to have children.
I think the first time we were told, I mean, that was absolutely, well, it's terrible. It's difficult to explain, it's awful. It's sort of devastating. And that lasted for about 2 years, that intense sort of loss, really. It's as though somebody's died.
I said to Nino that he could divorce me because I can produce a child. And yes, we have been very, very near splitting up.
The actual mechanics of being infertile and trying to get pregnant is very difficult. It takes all the romance, the spontaneity away from your lives together. Your whole life is dominated by a temperature chart, by my monthly cycle, when we should make love with each other and when we shouldn't. And we've been doing this now since 1982.
We've got a little shop down there and we've worked together all those years to sort of build something up for a child. And then to suddenly find out that, you know, there's something fairly serious there. I know we both sort of suddenly thought, well, what have we worked so hard for?
My brother, his girlfriend, just got pregnant and they were worried about phoning us up. They're a bit worried to tell you.
Yeah,
I mean, it's not a disease we've got.
Robert Winston, the leader of the Hammersmith IVF unit, was the first consultant in Britain to offer in vitro fertilization on the National Health Service. In 1984, out of 5,000 NHS and private patients from Britain and abroad, fewer than 200 were accepted as suitable for IVF. And of those, only 28 had test tube babies. Infertile couples often conceive only to lose the pregnancy later.
What about you?
39.
It may be, for example, ectopic, lodged outside the womb.
I got pregnant very quickly after the first lot of tubal surgery, and then I miscarried at about 4 months. And then it was 12 months later when I had the ectopic on the same side.
Right. On the right side?
On the right side, and they removed the ovary as well. There again, I don't know why.
Glad to see you can pronounce the word ectopic. And what happened after the ectopic?
After the ectopic, I had further tubal surgery on the left side.
This is becoming an annual event, so I suppose it's 78.
Yes, I think so, yes.
I sort of like grin and bared the pain for at least about a year. So in the January of this year, that's right, they did another laparoscopy, and this time I was pretty angry, and because they came back again and they said that you're not getting any. They saw no reason why I was getting pain.
Why were you angry?
Because the way they said it as if I was imagining the pain. So I turned around and said, well, I'd like to see a psychiatrist then, because I'm getting this pain and you're saying there's no reason why I should get this pain.
When he came round to see me the next morning, he said, had I heard of fertilisation? And I just looked at him.
In vitro fertilisation?
In vitro, whatever it was.
Yeah,
right. And he said, well, test tube baby. And I said, well, no.
And I think there are basically at least 3 things you've got to consider. One is that there may be nothing we can do for you. That's a real possibility. I'm not just saying that. That's a real possibility, and you've got to come into hospital with that in mind, because you might be disappointed otherwise, and you'll have to face that fact if you want us to do anything. The second thing is that we might advise you to have tubal surgery. And the third thing is that we might advise you that in vitro fertilization would be a better bet. But until we've done the telescope examination, we're not really in a position to tell you.
The question to be decided by the examination is whether the patient's natural ability to conceive can be restored. Normally, one or other fallopian tube gathers up a ripened egg from its follicle or sac on the surface of the ovary, and after fertilization by the male sperm, carries the embryo down to the womb to implant itself there. If the fallopian tubes are blocked, or so badly damaged that they can't be repaired by surgery, IVF's the only possible treatment. The two ovaries will be stimulated to produce several eggs each. These will then be drawn off through a tube to be fertilized by male sperm in vitro, in a test tube. After 2 days, the successfully fertilized eggs are re-implanted inside the womb through a tube inserted into the vagina.
How many anaesthetics have you had? It must be about 10, isn't it?
How many?
Anaesthetics?
More than that. I've had 14 laparoscopies.
14?
Yeah. All in all. This is number 14.
I think we're going to award a gold medal for the patient with the most number of laparoscopies. Yes. All right, so we'll have a look today, and I'll see you afterwards and tell you what we found.
Okay.
Yeah, okay.
Sue Marshall, the oldest patient on today's list, has already spent £7,000 at a private IVF clinic. Now the money's run out.
Big scratch.
All right. All right. All right.
The technique is to use carbon dioxide to lift the abdomen wall clear of the internal organs to give an unobstructed view for the laparoscope.
And let off some of the excess gas, because I don't really want her tummy too extended for too long. It's not a very good idea for her. Well, she's had some pretty grotesque tubal surgery, I think. I mean, there are huge stitches everywhere in the abdominal cavity. Quite interesting, really. An eloquent testimonial to how tubal surgery has been practiced. I'd like you just to inject some dye so we can just see whether that tube is open or not. Because obviously, one of the things is that this is a fertility assessment. And there's this fascinating picture of blue dye scattered everywhere, except in the fallopian tube itself.
For Sue Marshall, IVF's the only hope. For Sharon Drummond, the youngest patient, the laparoscope reveals a different situation.
This lady's had an ectopic pregnancy. Mrs. Drummond's had an ectopic pregnancy on the right side. Most of the tube is missing. Quite a lot of adhesions around the right ovary, which I'll divide. I might be able to do that this morning, actually, to save her an operation. In fact, I think I'm going to try and do that. This is quite interesting, because I think the choice here is about equal between the test tube baby or tubal surgery. The remaining tube is in not bad condition, although it is blocked. Can I take the laparoscopic scissors, sister? And I'm going to try and divide these adhesions.
Frequently, a web of filmy strings left by infection or scarring after surgery sticks the reproductive organs together, so hindering egg collection. Suddenly, Robert Winston finds he's hit an unexpected blood vessel.
I don't believe this.
Internal bleeding can kill. The urgent need to stop it puts an end to any thought of clearing adhesions.
Well, if this doesn't stop, we're going to have to open this.
It's some minutes before the severed blood vessel is successfully sewn up.
Well, the lady was right to be nervous, wasn't she?
Next morning, Robert Winston and his team deliver the preliminary verdicts. First, Jenny Gratwick.
For pain showed bilateral tubal damage.
I'm afraid that it's a pretty nasty mess, actually. I would have thought, really, that you're not actually suitable for in vitro fertilization as you stand because of the adhesions around the ovaries, which is a bit of a shock because I wasn't really expecting that at all. I'm sure it's a shock for you, too. One of the possibilities we might offer you might well be some surgery to divide the adhesions, possibly with test tube baby treatment afterwards. I think it's not something I could decide today.
As it turns out, two couples, the odds heavily against them, for the moment withdraw. Two patients have to wait for preliminary surgery. Three couples remain. Sharon Drummond, a 23-year-old contact lens maker, and Billy. Sue Marshall, a 39-year-old social work assistant, and Roger. Dawn Cassandro, a 25-year-old hairdresser, and Nino. But after 5 years of trying to have a child, after a failed pregnancy and failed surgery, why do Dawn and Nino persist?
My family were 10 of us, and it will be unfair, to show my parents, after so many years, I cannot produce one. I would like to show him to them, I'm capable for that, anyway.
In the name of the Father, and of the Son, and of the Holy Spirit.
Today is Nino's brother Ulrico's wedding day.
We welcome you.
The Roman Catholic Church doesn't believe that children should be sought by every available means. It frowns on IVF and would, if it could, forbid the research that goes with it. Nino Cassandro won't accept such teaching.
The church does all the best they can to keep us away from all these test tubes, babies or whatever. Myself, I feel if I got hope there, I'll put the church in the second place. First my life and then probably the church. That's the way I see it.
And then fish. And then what?
Marriage should be with children. If you haven't got no children, you haven't got nothing. All you can have, it's your own blood, is it? That's your generation.
I mean, I want to produce a grandchild for my parents just as much as Nino does. There is no difference in there. It's just that Italians are a family and they stay a family. Of course, Nino comes from a rather large family. It feels that we are missing out. And we know that if we had a child, the child is missing out on the love that is in the family.
No matter all the pain and the aggravation and everything I've been through, the most precious gift that I could give to my husband is a child of his own, and I want to give that gift.
And you're prepared to go through a lot more?
Yeah, I am prepared to go. I know that I can't go through any worse than what I've already been through. The pain, I know the pain now. And I can bear the pain because at the end, I may have the result to give to my husband, the gift of life.
Sue and Roger Marshall have been trying to have a child for 10 years. Their 5 previous attempts at IVF, privately, produced a single egg fit to be fertilized and replaced. But there was no pregnancy.
The first 2 years, I think we were just normal husband and wife, but for the last 10 years, since going through this, it has brought us a lot closer together.
I don't feel I can give up. As long as there's somebody who's willing to treat me, I'll try it.
If there is a possibility, then you probably never forgive yourself in the end for not taking that possibility.
But I think you say, is there an end? I think this is the end. This is the last chance, as far as I'm concerned, anyway.
Hammersmith Hospital's IVF patients have to go through a month's dummy run to see how their ovaries respond to Clomid, the drug designed to make them produce extra eggs. Sue's blood has to be taken for testing by her GP, if she likes, on 6 days during the first fortnight of her menstrual cycle.
Thank you.
Thank you.
Thanks.
Now, you send that off, don't you?
Yes, I do. Thank you very much.
Right.
For Sharon and Billy Drummond, seeing their niece grow up has given them a good idea of what having a family would be like. They've been trying to have children of their own ever since they got married 5 years ago. Not long by some standards.
I often say to him, oh, you can marry someone else can give you a baby. Well, it is all my fault. Well, we can't have children. I mean, it's nothing to do with Billy, and I feel sometimes that it is my fault.
Yeah, that's rubbish.
But you keep saying rubbish.
Rubbish. Never.
I mean, at the beginning it was terrible if I was only one day late in my period, I had the smock dresses on, standing in the mirror, thinking this is it.
Bottle of predictor.
I don't know how many of those I've been through. Sort of day late and I go and get a predictor.
Yeah.
It's just those sort of things. It's
Well, it's always there.
Yeah, you can't forget about it. Actually, most people, the people that have got children, said, oh, I love my children, but I wouldn't have them again if I had my time over.
You don't believe that?
No,
No, not for a minute.
no.
In a third of all cases, it's not the woman but the man who's infertile. So he has to provide sperm samples during the assessment cycle and during treatment for testing, and again for the fertilization of the woman's eggs. It's a nerve-wracking, embarrassing and sometimes traumatic experience. If the sperms are energetic enough, they'll swim to the top of this test tube where they can be removed for examination and counting. The target's a sample containing 1 million separate sperms.
Hi. What I'm going to do is to just go through the results. So the first thing, the blood test that you have done, they're all very good and they show that you're ovulating normally, and so we're quite happy about that. We also saw your response to the Clomid, and in fact you're superb. You're by far the best of anybody that we've ever done.
Great. Oh.
Right? I mean, even on Clomid alone, you'd have at least 4 eggs there.
Oh, great.
And whereas the drug treatment, if you remember, is Clomid followed by Pergonal that we give you. So hopefully you respond just as well in that cycle.
I do realise it might not work, but I do hope it will work. For Sharon's sake. Not for my own, for Sharon's sake. To save her going through any more. Because it's a long road.
Sue Marshall's results have also been good. Success is a stage nearer.
We have fostered, so we do know what it's like to have a baby in the house. I know it is different, and life would be very different from what it is now, especially as we've got into a pattern now of being rather selfish, I suppose, and doing exactly what we want when we want.
It'd probably be very interesting to change at this time of life.
Yes, but it hasn't stopped us wanting one. But I do accept that it wouldn't, that it would be different and probably more of a strain on the marriage, probably.
It's 3 months since the group of 7 hopeful couples set out. Sharon's menstrual cycle has started.
Say bye-bye.
In order to get to the hospital by 8 o'clock, she and Billy have come up from their home in Hampshire to stay with Billy's brother and his family in Southwark, near London Bridge.
See you later.
Bye.
Come on then, let's go.
See you.
See you later, Billy.
Okay. Yeah. Good luck. See you later.
Okay.
Bye. I've had to give up work. I haven't worked since Christmas, from the beginning of the treatment, and I don't know when I'm going to go back. We depend on my money. When you've got to pay for fares going out to London, we've had to use a lot of our savings. No one ever said it would be this involved, not the travelling, and it's just so strenuous and emotional. The treatment's free, but you don't realise when you commit yourself that you've got all this to worry about as well.
Today brings the first of a series of daily blood tests and examinations. They'll confirm whether Sharon's ovaries are again responding to the Clomid pills she's taking to stimulate egg production. The most direct way of seeing how eggs are developing in the ovaries is ultrasound scanning. Millions of pregnant women have had it used on them to show how their babies are growing in the womb. Here, the tiny follicles, or egg sacs, being filled with liquid, don't reflect the high-frequency sound waves and so show up dark, like the distended bladder, which fills the abdomen and pushes the ovaries into view.
So that's your bladder, and then this here is the uterus. That's your right ovary there. And you see there's a black hole just there. And you see that?
Yeah.
That's the follicle in which the egg's growing. And you have a few more. There's one more up there. So these are follicles that have started to develop.
And a week later?
Well, I've got to go for 4-hourly blood tests now. They've got to check my blood 4 times a day, which means going in at 8 o'clock in the morning for blood, 2 o'clock in the afternoon, 8 o'clock in the evening, and then 12 o'clock midnight for your last blood test. So I can't possibly stay at Southwark anymore. It's going to be too tiring to travel, so I've booked into a bed and breakfast, which is only down the road. And I find it very lonely. A lot of the women have got their husbands with them, and I haven't seen Billy now for a week. That side of it, it's very lonely. If I had him to at least talk to, and we'd be together, so I feel a bit down at the moment.
This is your left ovary.
The ultrasound scan is about to give its most crucial verdict. Are there any eggs mature enough for collection?
Well, you're doing very well. One there, another one there, another one down here. That's 4 very good sized follicles in your left ovary alone. Let's just have a look at the right ovary. And here you have a couple. All of them are very good size. And also, in fact, there's another one down here. So it looks like you're developing about 6 or so eggs. And hopefully we'll be able to collect them all at laparoscopy. Yeah, see you at 2 o'clock.
The removal of one fear only brings another in its wake. What if the precious eggs are lost through Sharon's normal ovulation before they can be collected? In fact, during the anxious wait, the body does give warning of ovulation. A day and a half beforehand, the womb, as it prepares to receive the embryonic baby, produces a hormone surge. It's not easy to know exactly when that begins. But if, in anticipation, the doctors simply inject the identical hormone themselves, then they can choose the best moment for ovulation and egg collection.
Right, excellent news. You haven't started that hormone surge as yet. Okay. We think that you need that injection, which makes you ovulate. Yes. You need that injection tonight. So what I want you to do is come back for blood at 8 o'clock, blood at midnight, and then immediately after you've had the blood, they'll give you the injection.
Yeah.
35 hours after the hormone injection, 37 hours would be too late. Sharon, admitted overnight, is ready.
They give you this better.
That's it.
No.
Feeling a bit sleepy now.
It's all right.
What was the ultrasound picture? Just remind me.
5 on the left and
5 on the left
and 2 on the right. This must be the
Four big ones on the left, 2 or 3 that's on the right.
Laurel Sher classicists will always state that the more inaccessible ovary is the one that... Right, well, I'm glad to say that the bleeding she had at laparoscopy last time has caused absolutely no damage whatsoever. So that's encouraging, isn't it?
Too much light is thought to damage eggs.
Lights off if you want to. Thank you.
Ready to section.
Entering the follicle now. Hang on, don't suck yet. Suck.
Sucking.
Coming clear, coming clear, coming clear.
This is the left ovary. It's a large follicle. Keep sucking. Stop sucking.
Stop.
Let go. There's lovely, isn't it?
It looks as if we've got one, Robert.
Yeah. Yes, there's an egg there.
Good. Thank you.
Sheila. We've got something.
There's definitely something.
Looks more like a cyst than a follicle, actually.
Good size, though.
Well, contents are more important than the size.
Not yet. Yeah.
It's there again.
First set of Hammersmith Quins.
We've got 5 eggs. There's a 6th. We've got 6 altogether, but it's possible that one of the eggs might not do too well because they had a bit of trouble extracting it. But we've got 5 very good eggs, so she's really right on target. I mean, it's as good as you can hope for. Can't do that.
Pleased with that.
She's not been overstimulated.
Yeah.
And
it's lovely.
So we'll keep our fingers crossed that puts her in the best bracket for a possible success.
Okay. Just got to wait now.
She's fine, and we haven't had any bleeding this time. Right?
Good. Happy and
She'll be off the table without.
Six eggs. 6 eggs. Yeah, you still doping? 6, yeah, lovely, eh? Maybe fantastic, yeah. Yeah, one's maybe a bit dodgy, but that's 5. Yeah? Yeah, lovely. How are you feeling? Yeah? You all right? Soon be waking up. Yeah? All right? Okay. You'll be all right? Yeah? Pardon? It's all over, it's finished. No more. It's going to work.
How are you? I'm not too bad.
Morning? What time did you get up this morning?
About 5:30.
By happy coincidence, Dawn Cassandro and Sue Marshall's cycles are almost exactly synchronized.
Yeah, I don't know.
Really tired.
You had yours last night?
Yeah.
Running a fortnight behind Sharon, they too have reached the stage at which they have to concentrate on the ritual of daily treatment.
Actually, I have to go. You've got my calling me for my scan.
Okay, see you.
Within hours of Sharon's egg collection, her eggs are ready for Billy's sperm. This is the mysterious moment of conception, the genesis of a potential human being, as each separate egg is lifted from its own nutrient medium and placed in the teeming sperm pool waiting for it. Within a few days, Sue Marshall and Dawn Cassandro are steeling themselves for the exhausting routine of giving blood 4 times a day. Together, they've moved into a hotel room not far from the hospital. What's the treatment been like so far?
Agony. I'm frightened all the time. I fear that every minute something's going to go wrong. It's just very nerving.
How's it affected you?
I get very nervous. I get bad temper most of the time, especially with my husband.
The worst bit, I think, is having a scan with a full bladder, because it's very, very difficult. You have to have a very full bladder. And of course, there are other people waiting to go in as well. You're just sort of picked at random. So you're absolutely busting. And then they put the scan across your stomach, which makes it even worse. That's very unpleasant, isn't it?
Yeah, they sort of prod and you think, oh, please, oh, I've got to go, and you pray that you can make it from the bed to the toilet. It's amazing that you do make it. Sometimes I think to myself, how did I make it?
How on earth do you listen to what they've got to say?
You don't. You don't.
All you're concentrating is you mustn't go. You keep your head. And they're going on about things, and they may ask you a question or whatever. You wouldn't know what you've answered or what you said.
Yeah, and they say, look, we can see a follicle. Can you see it? You go, yes, yes. Just because you want to get off the couch, you just want to go to the loo, and that's it. So you can't really concentrate on it.
Yeah, if they'd said to you, oh, look, there's a bomb in there, can you see it? You'd say, yeah. Just so that, please let me go, I want to go.
Is it painful at all? I've heard that it's like having period pains all the time.
Yes, I've had a few days like that. But then, yeah, that makes you even more worried because you tend to think, oh, that's it, I've had it, I'm coming on, I'm going to start my period, that's it, that's the end. And so you worry, you get more pains, and you worry more.
So I think you're on day 10 of the crucial cycle and coming up to a moment of decision. What is the situation?
Well, it's not really very good at the moment. I've only got, as far as I can see, 2 follicles, which isn't really enough. And the hormone levels also aren't high enough, but I should really know this afternoon or later on this evening.
Are you bracing yourself for failure, or are you still urging yourself forward to success?
A bit of both. Mostly bracing myself for failure.
Basically, we've pulled you out of this because the response that you've produced is, I think, by any reasonable standards, inadequate. The hormone levels that you've been producing from the ovary are quite low, and would suggest that at best you'd only have 1 egg. The assessment cycle we had before, admittedly, one of the bloods broke in the post, but nonetheless, it does show that you are potentially capable of responding quite a lot better than that level. So I think really we have no alternative but to abandon the treatment at the moment.
For the present, Sue and Roger Marshall must drop out. Of the original group of 7 couples hoping for a test tube baby, only 2 remain. Meanwhile, Dawn Cassandro's treatment has been accelerating. For her too, daily visits have become a 6-hourly regime of tedium and anxiety. Then, admission for the operation that's the key to all her hopes. The result? 4 good eggs. Examined, fertilized. So far, so good. Most eggs mixed with sperms are successfully fertilized and become embryos. Numbers are important because to have 4 or 5 embryos instead of just 1 does much more than quadruple Sharon's chances of a pregnancy. But what kind of embryo also matters. The original single-cell embryo should be well-shaped, it should divide evenly, and not have too many bits and pieces attached to it if it's to implant in the womb and develop properly. A bare fortnight has passed since Sharon's menstrual cycle started. The last 2 days of waiting have been the worst so far.
We think we've got, in fact, at least 5 of the eggs fertilized. It's at least 5, isn't it, Steve?
5,
yeah. And it might be, there might be a 6th, but what we think, hold on a second. What we think really is we've discussed this, and I think we both feel that it would be a bit unwise to transfer more than 4 of them.
Yeah.
So what we would plan to do is to transfer the 4 best ones.
Yes.
And we'll just leave the other one.
Yes.
That's what we're aiming to do. So you're in a very good situation.
Yes. Oh, good.
Okay. So hang on a second. We'll just get the embryos up, and then we're ready to go. Only take a few minutes. Right. No. Then we'll explain what we'll do. What we're going to do is to have you kneeling like this with your feet over. Do you see that? Over the end of the bed. And then we'll put the embryos with you kneeling down like that, because that actually gets the eggs at the end of the uterus, and we think that might be better than having you flat on your back. It actually doesn't make any definite difference, but that's the way I think the transfers go best. And I've had most of my pregnancies that way. So.
Good.
Right.
Yeah.
Do you want to have a practice?
Right.
That's it, that's fine. That's good. That's fine. Yeah, that's it. That's all you have to do. And you'll be like that for about 2 minutes.
Yeah.
And then we'll tip the table down.
Yeah.
And the worst part of the whole thing is to give you an injection.
Oh, that's not
All right.
fair.
Take a seat if you will. And there will be a bit of hanging around, because if we're handling 5 embryos, it physically takes a moment or two to get, you know, to get them sorted out and work out which being the best ones to transfer. And so on.
Will we able to see them before you?
Yeah, sure. We'll let you have a look. Dr. Hillier will ask you to have a look if you want. Right.
It's 4 cell, grade 1.
Great. And the choice is fairly easy, isn't it?
Yeah, I think so. The 4 good ones are at the bottom, the one that's just good at the top.
Pardon?
The 4 good ones are at the bottom. There are little spots there. Can you see them?
Yeah.
Okay.
Oh. Right.
Little Johnny on the beach.
Yeah.
First photograph. There's a tiny on there. Absolutely like specks.
Okay.
Is that the 2 other ones at the top there?
Yeah, you can just make them out together. Footballs, aren't they? Yeah. Okay.
God, they're right, eh?
I'm ready, yes.
Hello.
Hello, Mrs. Drummond.
Oh, hello.
Hello, it's Robert Winston speaking. How are you?
Nervous.
Are you nervous?
Yes.
You're not holding the China teapot or anything, are you?
No, I'm sitting down. Positive. Oh. Hang on, Bill, I can't hear. Sorry, can you say?
I just want to say that I don't want you to go over the top about it because although the levels are fine,
Yes.
Sometimes the levels are a little bit low in perfectly normal pregnancies, and yours is not abnormally low, but it's on the low side. So
Yes.
I think we should probably just repeat it in 2 or 3 days' time.
Yes.
All right?
Yes.
But work.
Yeah.
All right.
Okay then.
Okay then.
Thank you. Bye.
Oh. Oh. Get them up a bit more. 1.5 measures. Yeah. It's nice.
How many?
Eh?
How many?
4.
4.
4. Yeah.
Good morning, Salon 5. May I help you?
Hello?
Hello?
Mrs. Cassandra?
Yes.
It's Dr. Hannah from the Hammersmith.
Oh, hello.
How you doing?
I'm all right, thank you.
Mrs. Cassandra, we've done your test this morning, and unfortunately it's not positive.
Pardon?
It is not positive.
Okay.
As we know, there are some patients who are ideal like you, but still we don't manage to get pregnant on the first time. So I want you to have some rest for a couple of cycles and to come back and see me so we can hopefully offer you another attempt. All right?
Yeah.
So please ring the clinic in few weeks when you're feeling a little bit better and just make an appointment and come and see me.
Okay.
All right?
Right.
Is your husband with you?
Yes, he is.
Fine. So I'll see you soon, Dawn.
Okay, fine.
Okay?
Okay then.
See you soon.
Yeah.
Bye-bye.
In the end, only Sharon and Billy Drummond have achieved a pregnancy. Now Sharon has a mere 10 days to go before the baby's due.
It hasn't been a really good pregnancy. I mean, what I'd expected. When I couldn't have a baby, that's what I was looking forward to the most, the pregnancy. But it's not a bed of roses, really. You feel awful.
Just great what's happened. I just wish that other couples could be successful as we've been and just bring them some happiness.
At the beginning of the pregnancy, you don't really think that much of the birth. It's a long time away, but I'm really getting excited now. Just thinking that probably this time next week even I could have the baby.
In fact, after many false alarms, it was a fortnight before Sharon was ready to give birth. The labour was hard and lasted 15 hours.
Keep pushing, keep pushing. Don't stop now, come on.
You should do it now. I keep saying that, but you just don't know last bit.
Harder.
Come on. Push. Push down. Come on.
And again. No, let the breath out. Take another one. That's it. Come on. Push down.
Big breath and again, while it's still there. Well done.
Come on, Sharon, push.
Big baby.
Symptometry I haven't given yet.
It's all right, no, she doesn't need to be intubated. It's fine. It's fine. Just hold on to it, it's fine.
It's a boy.
It's a boy. Is that what you wanted?
That'll do. Yeah, 6 over 11, doesn't it, Mother? There's...
You're a good girl. Boy, sorry.
Yeah.
It really is. You can never sleep now. Ah.
The face will be a little bit more squinty, all right? This is just from the forehead now. They'll all settle down, all right? They will do fine. Okay?
Yeah, over your lungs, mate. Yeah, it's your mummy.
Come on.
There you go.
Oh, baby.
You took your time coming. You took your time coming. Yes. Yes. Yeah. Yeah. You let everybody know you're there. She'll be with you in a minute. She's got to have a sleep. She's tired as well. Yes. Yes. We don't need to hear that noise. We don't need to hear all that noise. Daddy was doing it all wrong. He was. He was doing it all wrong. He was. He's only teasing you. Oh, he's only teasing you. He's only teasing you, he is.
A naughty boy.
Taking your time coming out like that.
Yes, you have.
Yeah, never meant you here. You're here now.
You're here.
You haven't got ginger hair. That's what your mum was worried about, your ginger hair.
After the gift of life was made, 4 of the 7 couples gave up trying for a test tube baby. Mark and Jenny Gratwick decided to go ahead with adopting a child. Sue and Roger Marshall at last came to terms with being childless and are enjoying life together. Mike and Jenny Devereux this month will be going through their 3rd attempt at